Okay, I just want to come to you guys today and do a very quick update. I'm actually sitting outside my doctor's office right now. My appointment is like in 30 minutes, and I've been sitting here already for 30 minutes eating. Well, let's see. I am currently 13 weeks and 6 days, so I'll be 14 weeks tomorrow. I've had another ultrasound since I last talked to you guys. Had an ultrasound last week just to measure the nuchal translucency, the part of the baby's neck and the very back, to see what the risk for Down syndromes is. And that measurement at the back of the neck had to be less than 3, and I think baby's was measuring like at 1 or something like that. I did get a ultrasound picture of the baby. When we were there, the ultrasound tech looked and she said, "Oh my gosh, it might be a girl." So I momentarily got excited. But when she moved the probe around and got a good angle, I swear, there's a nub in there. I'm thinking like I'm 90% sure that it is a boy, which is fine with me. No big deal. I like boys. They're cool. They're dirty. They're fun. So, what else? I had an appointment this morning with my high risk OB, just to go over some other things. My regular OB did a test and said that my thyroid hormones came back low, which indicated hyperthyroidism. So I saw an endocrinologist, and she decided to prescribe methimazole. I think that's the name of it. I'm not sure. Anyway, when I went to the pharmacy to pick it up, the pharmacist was like, this is a class D drug, right? I'm like, no. So what I decided to do was go to my high risk and talk to her about it to see what she thought about it. And her advice was to start taking the drug after I turned 14 weeks. With that particular drug, the risk to baby is a birth defect where the skin doesn't form correctly on the top of the scalp. So she said after the 14-week mark, the baby's skull and all that is fully formed, so the risk goes down significantly. So I'll start taking that medicine probably on Thursday, just to add to my long list of things. Let's see what else. So many doctor's appointments. This doctor appointment that I'm sitting at now, this is just my regular rheumatologist appointment. I haven't seen her since I got pregnant, so that'll be news to her. Hopefully she'll be just as excited as I am. I think that's about it. Oh, other than that, I've been feeling okay. I've probably thrown up about 4 times, and it varies. It's always in the middle of the day. It's not the typical morning sickness. I feel okay. Got a little bump growing. Nothing too major. See if you can see it. Nothing too major, just a little bump. It looks just like fat to me, not really baby. I do feel movement, but not consistently. It'll be just sporadic. Once a day, I'll feel like a huge bump that lets me know for sure, okay, that was baby, that wasn't gas. But yeah, I have started itching all over, like my body. That started last Thursday. Insane itching. And I looked up online to see, what it could possibly be. And of course, Dr. Google just scared the crap out of me. There's some condition that's associated with liver failure that could cause you to lose the baby. So I talked to I talked to the midwife today over the phone, and she told me that particular condition that I looked up does not kick in until the 3rd trimester, if that is, what I'm experiencing. She thinks I'm just having an allergic reaction to something. I stopped taking progesterone pills last Tuesday, per my OB, because he wanted me to stop taking the pills, and then at 16 weeks I start with the shots. So I'm thinking it might just be a side effect of that, or I don't know. My body does weird things. Who knows? But yeah, that's the update on me. I know it's kind of all over the place, but that's literally been my life these last couple of weeks. I've had so many doctor's appointments. I mean, it's been a lot, and I just got promoted at my job to supervisor, so that's been a very big deal too. So I'm just trying to take it one day at a time, trying to enjoy the pregnancy, and just try to stay stress-free, because with me, when I do stress out, my lupus tends to flare. But thank God that my lupus has been so quiet, like totally quiet. I got some lab work done yesterday, and everything is normal. I mean, that's crazy for me. My CRP level was like 0.6. That's awesome for me. Usually my CRP is about 7. Less than 0.2 is the normal range for that particular lab. So to have it almost close to the normal range is just awesome. My SED rate was 38, which is slightly elevated, but it's very low for me. My SED rate is usually like 60 or 70. It's been as high as 140 before. My platelets are back to the normal range. It's about 280. So my platelets usually run above 400, which is very increased. So I'm just happy that I am in remission, even though I'm still on a lot of meds. It's just a good feeling to be able to go through my day, and also just to know that, oh my God, in a couple of months there'll be a new baby. Very excited about that. But anyway, just wanted to update you guys and let you know what's been going on with me, and just I'll talk to you later.